Hi, welcome to today's Leaders in Mental Wellness and Diabetes, where you will hear insights from the top minds in the world of diabetes care. Hosted by Dr. Char.
Hello, how are you today?
I'm good. How are you, Dr. Char?
Wonderful, wonderful. It's so good to have you.
Likewise. Thank you for having me.
Could you help me, this accent that I have, help me pronounce your name well? I got the doctor down pat.
Sure. It's Dr. Nana Quansah.
Thank you so much. So could I call you Dr. Nana?
Absolutely. Yes, you can.
Well, I understand that you're type 2, the diabetes, no?
No, I'm actually a pharmacist and I help people that living with type 2 diabetes.
Okay, well, I knew you were a pharmacist. That was coming next, but I thought you were type 2. I'm so sorry I misread that. But as a pharmacist, the first thing that impressed me was we think of going to you for medicine, and you're helping we diabetes patients learn how to use optimal sources other than or in addition to medicine. Can you explain that to me?
Yeah, absolutely. So I have been a pharmacist for about 7 years. So while I was in the retail pharmacy, I obviously was dispensing a lot of medication. So while I was doing that, I realized that a lot of people were not actually getting better. They were coming in and out of the pharmacy, getting the medication, and obviously some of them were also experiencing the side effect from medications, right? And you have those that are also frustrated because they don't want to be on the medication. So I witnessed that they were not getting any better. So that's when I was like, what is actually going on? So you realize that people think that just taking the medications is enough, but they don't realize that they can do other things or implement other lifestyle changes that can actually even perhaps reduce the medications that they are on or even supplement with the medications that they are on to have a better lifestyle.
Sure.
So that's when I realized that there's lack of education in this area. So that's when I realized that I wanted to venture into that arena and talk more about lifestyle changes.
That is so amazing. And the uniqueness of being a pharmacist in this area, in this community, it has to be unique, correct? I mean,
Absolutely. But now I believe you do have more pharmacists and even practitioners actually also utilizing that function. I call it functional medicine approach to healthcare because we all want to know what the root cause is. Because there are some people that are actually taking the medications and their numbers look good. But when you dig deeper, you realize that they are not feeling good, right? So there must be something going on other than just the symptoms that they are feeling. So there's a lot of, practitioners and stuff heading towards that preventative medicine aspect of life. Yeah.
And do you find it surprising that in the mental health space, the functional medicine side is where I have gravitated to?
Oh, wow.
I've been doing this for a long time.
Mm-hmm.
And I mean, a long time, into an age when it wasn't even popular to say mental health. We slipped it in on them if I got to see a patient with an endocrinologist. And so now the ability to help people reverse anxiety, the ability to just hear someone say reversing diabetes, and then to know that all the team players, such as yourself and all the professionals that are working together, are all thinking in the same, well, most or a lot are thinking in the same line. I think it's fabulous.
Absolutely. I definitely agree.
Well, now, there's all kinds of things I want to ask you about, but what you kind of told us what got you started wanting to help people, but how in the world did you get a ditch diabetes in 12 weeks? How in the world do you do it in 12 weeks? I am so interested.
Yeah, so actually I forgot to mention one of the things that was actually a wake-up call for me that really made me realize that I need to be part of the solution to healthcare was I had an encounter with a patient. It was an older lady who came into the pharmacy, and because of our relationship, she was able to obviously ask me to help her with the glucometer, like the monitoring device. And this is the same patient that we've been dispensing this device to for over 3 years. So guess what? That means she was not checking her sugar. And I realized that I failed as a practitioner because I thought, obviously, coming into that pharmacy, I'm pretty sure the other pharmacist or even the doctor's office had already, explained all that stuff to the patient, but that was not the case. So that's when I realized that there's actually a really big gap in our healthcare system. So I felt the need to be part of the solution to healthcare. So coming back to my wellness program, I wanted to do something that would, because obviously when you're trying to help people that have or that are living with a chronic disease, it's not an overtime thing. You can't really solve everything overnight, right? It takes a while. And you have to realize that it's a progression. It's a progress. It's not something that, okay, tomorrow evening I'm going to be feeling good and I'll be fine. No, it doesn't work that way. So I wanted it in such a way that it will be over a prolonged time. So I figured 90 days will be a good time for someone to implement these and do all these activities. And I have definitely realized that there is a change that comes after that 90 days.
So you're working past that 90 days now, I bet.
Not quite. I actually do stop because after 90 days, it's not to work with them forever. It's basically to also empower them. So I help them. I give them all the tools that they need. I encourage them. They pretty much regain their confidence back. And after several weeks, they are really confident in actually taking control of their health. So I don't go beyond that yet. I feel like that's definitely a good time. And after like 4 weeks, they are actually really good and they can take control of their health. But I'm also there as a accountability partner to help them, hold their hands and guide them through the process. Yeah.
And then your community. I love reading, like today, before we stop, I want to know how in the world to make, what's it called? Chia
seed
pudding. So after 12 weeks, if we go through 12 weeks with you, we're going to know what you know, right? You're going to teach us what you know on how to take care of ourselves.
Yes.
And your community, I'm sure they can learn a lot. Like chia seed pudding, who ever heard of such a thing?
It's basically a 12-week program, and obviously nutrition plays a big role in it. But when it comes to diabetes, personally, I think it's more so an inflammatory disease. So we have to take all that into consideration. We have to figure out what we can do to reduce that inflammation that is actually going on, because especially with type 2, the habits or the lifestyle that we are more comfortable doing is actually the same lifestyle things that actually cause that diabetes. So the same habits that caused it are the same habits that we can manage to overcome or regain our health. So not only do we go over nutrition, I also do, every week we focus on different aspects. So we do stress management, sleep hygiene, mindset, because it plays a very important role when it comes to chronic, management or even chronic illness. So we do different things and not only focus on nutrition. I give them meal plans and all sort of stuff as well. And then monthly I do workshops as well, just to have that hands-on experience. Because sometimes you can definitely talk about it and get them engaged, but you want them to have that hands-on experience. So we do virtual grocery shopping. We do a whole lot just to make it exciting and engaging.
So is everything pre-recorded, or do you do some individual work with the patients?
So if for now it's individual work, but in the future, probably with the educational part, just to make it more effective and also for them to be 100% engaged, I'm going to do the educational ones, maybe recorded, and then when they come, we are basically talking about, what was the experience? What did you find out? Like, give them, they will probably give me a record of what's going on in their lives over the week. So now it's the combination of the two, but I'm probably going to change it a little bit sometime in the future.
Well, that's so good to know. And I'm so thankful for this venue and to be able to get online and talk to each other, right?
Oh, yes,
Because
I am loving virtual.
We can learn about you and what you do and go check that out. And then my other thing is the diabetes workshops. Does that go hand in hand with this program, or is that something separate and individual by itself?
That is actually separate, but my clients who are already in the program get to, get the benefit of that, and they get to join that as well. So the workshop, if you're not in the program, you can definitely join as a single session, but my clients who are in that Ditch Diabetes program get the opportunity to be in it as well.
Well, win-win.
I know that's right.
Busy, let's see. If somebody's busy and they just don't want to commit to 12 weeks right now, they literally could get some of the same nuggets in the workshops. They're standalone, but it covers one of the areas, or at least a partial of an area within the workshop.
Yeah, it doesn't encompass everything that we talk about in the coaching program, because that's impossible.
Oh, yeah, right.
Obviously, in a 2-hour session or an hour and a half, I can't talk to you about everything, but it's definitely a valuable workshop where you gain a lot of hands-on experience that at least can help you start taking control of your health and know exactly what you need to do, especially with fact labels, nutrition fact labels, what to pick when you go to the grocery store, things of that nature. I think those are very important in the beginning to actually be aware of that as well.
So I'm guessing, you correct me if I'm wrong, but I'm guessing that if somebody is considering the program, then the workshops is a good way to get to know you and to see what they can learn. If they've already done the program, the workshops are good reminders of what they have learned. So you have done some real business planning with this, haven't you?
Absolutely. Yeah. Yes, I have.
That's good.
Yeah, and because it's not everybody who wants to also commit to a longer program, and it's not even about just getting a program out there. It's more so for people to get educated about what they need to do, because a lot of people get out of the hospital or the doctor's office with just simple instructions like, oh, you need to take control of your glucose or your sugar and eat healthy. What does that even mean? To a complete stranger, to a patient, what does that mean? What do you mean eat healthy? What does it consist of? So the how to do it is what is missing in our healthcare system. We don't give the directions as to what they actually need to do. We just tell them, okay, go control your sugar, make sure you eat healthy. So my purpose, even if people are not ready to commit into the program, I do have ebooks that I have the workshops, and I'm also planning on doing different things that they can actually do in the meantime, right? To help them be able to have that hands-on experience or know exactly what to do to go from A to B. And then when they are ready to commit or invest in themselves more, then they can join the workshop. So it's not, okay, I need people to join the workshop. No, it's just for people to have that education and the directions on what to do, because that's the missing key in healthcare. We don't give them directions.
Yeah, that's true. I don't know if you have such things as selling products that have your phrasing on it, but a Dr. Nana t-shirt would be amazing.
Yeah.
And then let me see, one of these things that I saw, from powerless to thriving.
Absolutely.
That's a great t-shirt.
I love it. Yeah.
That's a
good
great
idea.
T-shirt.
Yeah, I was actually thinking of one that says leaving diabetes in the dust, because I had a webinar with that title and I loved it. So that's in progress. Yes.
Leaving diabetes in the dust.
Yes, that was the title of my webinar.
I love it. So if you don't have that shop where we can go get t-shirts,
it's coming.
You got to get it there. You have to get it there. But one has to be a day in the life with Dr. Nana. I would love a t-shirt that said that.
I love it. I love it.
Well, what do you, when a diabetes patient comes to you, I'm guessing they want to know, pharmacist, how, you're going from pharmacy to this. What is the one thing? It's not advice. I think we don't actually give advice, but what is the one thing you hear yourself telling everybody, something generally that you share, that you give a tip to everybody?
So I believe first off, it's because a lot of people don't see the urgency in this illness, and they only think that they just need their primary doctor. But when it comes to diabetes, it's a multifunctional approach to it. You need your pharmacist on board, you need your doctor on board, you need your foot doctor on board, you need a kidney doctor, like you need a whole lot of people on board. So that's what a lot of people don't realize. They think that so far as I just have my doctor, that's good enough. But obviously you have to realize that a doctor is involved in a lot of stuff. They won't be looking at your foot, they won't be looking at your medications and all that stuff. It's a lot. So you cannot do this alone. And you definitely do need a very good support system. You cannot do diabetes alone. You need that community that will inspire you, because it comes with a lot of emotional cycles. And a lot of people don't realize that, just waking up, checking your sugar, going to restaurant, figuring out what you're eating, all this stuff is just too stressful. It is definitely very stressful. So I usually tell them to have a very good community around. They need a good support system. And also, a lot of people, when they get diagnosed, they get fearful, which is understandable. They get fearful of the complications and all that stuff. But you have to realize that it's just a diagnosis. It really does not define you. And you have that power to rewrite your story. You have the capability to change the story. And that's definitely you taking things into consideration and doing things you have control over. And that is the way you will live and what you put on your plate. Environmental toxins and things of that nature. You are responsible for that. So people shouldn't really be down on themselves. There's a way you can thrive with it. And that's basically just trying to change it one day at a time. It's not going to be like a big change, just small baby steps is all that you need.
I love that we can also be online, and that you as a coach, I don't know if you label yourself as that, but in that arena of helping people, of coaching people and encouraging them and helping them to thrive from a powerless place is amazing in itself. But yes, we all need our support. And the good thing is we have support teams we can put together with the different expertise. With all the different specialties. But some people do not have those wives or husbands or partners that help them do the research and cook the meals and decide. They're on their own. Then when we get online, we're very grateful that we can get online and find the information. But oh my goodness, that's a university of information that sometimes is overwhelming as well.
Overwhelming, I know.
So when there is somebody that comes along and we can find a connection, I know none of us are for everybody, but for those that you are for, when they find you and they find a community and they find different little things that are attractive to them. Like for me today, the dadgum pudding was attractive. It attracted me. So if I hadn't had you and I hadn't had the meeting today, I would still be interested to go back. And for those people that need the support you're talking about, but they don't have the natural support, this online gets so big. If they just identify with one person, one smile, one pretty face, and 12 weeks of a program or a workshop or two now and then, and read every post, don't you see that as supporting those that do not have it around them?
Yeah, absolutely. I definitely agree because there's a lot of information out there in the way, and it really does get confusing. Even as a practitioner, when you go online, it's like so many, like it's just so many, and it gets confusing. So sometimes you have to realize that even them getting the information, it becomes stressful, which obviously can even make their blood sugar go high,
It can,
right?
it
Because their
can.
cortisol levels will go up and they are stressed because everyone is saying different things. So one of the things that I also have is like a group. I have a private Facebook group, and I actually funnel them through that. So if you follow me and you're more interested in really getting to know the information, I try to present my group to you. It's free. You don't have to pay anything. So it's a private Facebook group, and that place I further educate, and we get that more, I guess it's not really one-on-one per se, but we get that intimate a little bit. At least you can message me, you can put a post out there, and if you have any, unless it's specific, if it's a general thing, you can just put it out there and we all can talk about it as well. So I do have a Ditch Diabetes group on Facebook, which is private and it's complimentary. It's free for people who are more interested in it. Yeah.
Well, so I think to end this today, I think a great way is to say, when you get inundated with the information, if anybody is listening that just ran by us and Dr. Char, who are you? We know Dr. Phil, we know Oprah, but who are you? And they just ran by it. I guess my biggest takeaway or encouragement today is to find you and turn away all the noise for the time and hone in on just what you're doing, what you're saying, and see where they can fit for the support that they can get. And let's all get better. Let's all get better. That's what it's all about. Now, give me some just quick information in case somebody wants to write it down so that we can just audibly say it. Where can they reach you? Easiest way to find you? And
Sure.
I think it'd be a very much waste not to now give them that refreshed view and way of reaching you. So
Sure. So I do a lot of education online. So on social media, on Instagram, my handle is at dr.nanaPharmD. And then on Facebook is NAQ, Nancy Apple Query Pharmacy Consultant as well. So those are my two social media. And I do have a YouTube channel. I'm not too good at posting every week on that, but I'm working on it. And it's All Things Diabetes by Dr. Nana. It's on YouTube as well. And then my email address is info@naqpharmacyconsultant.com.
thank you so much. Thank you so much for coming
Thank
and
you for
joining me
having
today.
me.
But thank you for sharing that information. And I just wish I had tons of people to throw your way, because I believe you're going to do dynamic things to help
Thank
people
you for your kind words.
change the world. That's what we're in this for.
Yes,
And now we're a
absolutely.
team. Once we know each
Yes.
other, we know what we're doing, we're after the same goal. We are that support for each other. So feel free. If you ever need me, just feel free.
Absolutely. Thank you so much for having me. I appreciate your time.
Thank you so much. You have a good day.
You as well. Thank you.
Bye.
Bye.